of Nurses in Disaster Management. I would like to introduce the speaker for the day, Dr. Vanilla Chopra. She's a good friend and she's Head of Department of Critical Care Medicine at SMVD, that is Sri Mata Vaishno Devi Narayana Super Speciality Hospital, Jammu. She'll be sharing a few pearls of her wisdom on role of nurses in disaster management. Dr. Vanilla, over to you.
Thank you, Dr. Anjali. Good afternoon, everyone. Today, the session I will be talking of is the role of nurses in the disaster management. Yeah. So let's recall some of the major disasters which has happened in the previous century, like from 2000 to 2023. There are few glimpses of the Bhuj earthquake which happened in 2001, Indian Ocean tsunami in 2004, then Uttarakhand flash floods in 2013. We all know how much disasters they were. Kashmir floods in 2014, and there was from my hospital, it was nearby the Siad Baba disaster, which occurred in July 2018, and Vaishno Devi disaster, since we are putting up in Jammu, and we had seen the Vaishno Devi disaster, Stampede disaster of 2022. So let's start with what is disaster actually. The WHO defines disaster as any occurrence that causes damage to the ecology, disruption, or loss of human life, and it warrants an extraordinary response from outside the community area. So exactly, we are here to talk about what is the role of nurses during this disaster management. Basically, it is to determine the magnitude of the event and define and understand the health needs of the affected groups. And they have to prepare the priorities and objectives. And since they are working in a setup where they know all the pitfalls and all the shortcomings, so they know exactly what to do, and how to manage the things with the limited resources. So all we know is disasters are of two types, natural and man-made. The natural disasters are like cyclones, hurricanes, landslides, tornadoes, and droughts. And the man-made disasters we all have come across in the form of explosion, terrorist attacks, bomb blast, and chemical threats. Basically, in any disaster, there are three things which work in unison. It's the agent, environment, and the host. Agent, which is causing the disaster, environment, which environment is causing, and the host, which are the sufferers, basically. Disaster has main features of unpredictability. Obviously, we never predict, though at times we can, but most of the times we are not able to predict, and it is unfamiliar to many of the nurses and the medicos who are working in a setup. It's uncertain, obviously, and unknown and unexpected. Though we can expect a little bit, but we don't know exactly till it happens how much casualty is going to happen, how much damage is going to happen with the disaster. So, what are the phases of a disaster? Practically, there are three phases of a disaster. One is the pre-impact phase, another is the impact phase, and third is the post-impact phase. In the pre-impact phase, it is basically the initial phase of disaster. It occurs before actually the disaster happens, and there are warning signs which are there in the pre-impact phase. It could be because of the satellites, because of you usually heard like there are many weather forecasts are there, cyclones, the recent cyclone, there was a weather forecast. So it all happens in the pre-impact phase. Then actually comes the impact phase, in which the disaster actually happens. In this, the hardships are there, like anything, earthquake, cyclones, plane crashing, the terrorist attack. Actually, it is exactly when it happens, it is the impact phase. And then comes the post-impact phase. In this, there has to be recovery. There is mental trauma, there is physical trauma. The victims are there, the victims who have died, and then their relatives are there. So there is a strong emotional response during this post-impact phase, and all the things have to be made to work in an alignment. Basically, acceptance is not there, and there's denial from the victims and their relatives in this phase, and we all have to work together to make them come to the mainstream. This is a story of a Uttarakhand flood survivor, Malti Devi, in which she said she started her journey back after the darshan, and suddenly there was a gush of the water and there was a cloud burst, and all the people were stranded in a place where 20 people were just supposed to be there, there were around 200 people. And each were falling and crushing on each other. She said, like, my husband was dying of air hunger and she couldn't do anything in front of her eyes. So you can well understand the level of mental trauma she might have undergone during that phase of the disaster. So it is the just story of one. We have seen many in the times of Indian around, like how many disaster victims have put down their stories, and all are suffering from mental trauma, not at that phase only, but for the lifelong also. So we all know the most vulnerable people in the disaster is anyone who is elderly, pregnant female, a child, or an infant. And what is disaster nursing basically? Disaster nursing is defined as the adaptation of the professional nursing skills in recognizing and meeting the nursing physical and emotional needs resulting from the disaster. Basically, in this, they have to see for the supplies, the equipment available, the physical facilities available, and utilities which are limited or not available. So nursing plays a pivotal role in all the disaster management because they are the backbone of our hospitals. We all know we doctors can only work if our nursing department is strong enough to like support us. Only then we can work and cater a disaster. So what is the disaster cycle? It's a disaster management cycle is there. In this, exactly the preparedness phase, there are various phases in which are interlinked to each other. First is the preparedness phase, in which we prepare ourselves for the disaster. Then exactly the disaster phase is in which the disaster actually happens. Then there is a response phase, recovery phase, development phase, and the mitigation phase. So it can be defined as the effective organizational direction and utilization of the available resources. As we all know, whenever disaster happens, we are catering, suppose in an emergency where 20 patients are supposed to be catered, we almost cater 200 people at any point of time. So with the limited resources, limited infrastructure, we have to cater all those patients. So that is basically the management of disaster revolves around all those things. So preparedness phase, in this, the activities which we do prior to a disaster, for example, any exercises, trainings, with mock drills we do, and we develop some warning systems, code orange in the hospitals we usually announce, and we make a system for that. Then comes the response phase, in which exactly when the emergency is being operated in the response phase. Then comes the recovery phase, in which a temporary housing is created, long-term medical care and counseling to the victims and the attendants have to be given. And then comes the mitigation phase. Basically, mitigation is there to reduce the effects of the disaster if it happens. Like in public education, you need to tell in the schools, in the local community, like how if suppose the earthquake happens, like what are you supposed to do? How the things, a cyclone is going to happen, then how you are supposed to cater that in order to decrease the effects of the disaster. So that is the mitigation phase we have. In the preparedness phase, measures are taken to prepare for and reduce the effect of disasters. Basically, in this, we have to provide the maximal care, effective care to the patient. So in this, obviously, the mock drills, as I told you, always run a mock drill of disaster or fire, whatever in your hospital in order to prepare for the disaster. We should know, we should align an area, we should designate a nurse. Suppose there is an intimation, something is going to happen, something has happened. Okay, suppose the bus has fallen into a gorge. We know that 20 patients or 30 patients expectedly they are coming to our facility. So in order, we have to make a route map, like exactly in emergency where the patient is supposed to come, victim is supposed to come, then who is going to cater, which nurse is going to cater that in the first area, and then which areas to be delineated, what resources, you have to shut down all your OTs. The emergency OTs have to be run only, the routine OTs have to be shut down. All the medical personnel who are trained and they're having experience with the disaster or whatsoever, senior are there, they have to be delineated to the emergency department, shutting down all other things. Plus, you have to tell the blood bank people, like, be ready with the blood products and all. You never know how much blood is required. The laboratory people, obviously, they will be catering more of the investigation which they are routinely catered. So all have to work in unison. In preparedness, you have to prepare your facility for catering all those patients. So this is the, first of all, in this disaster, beds have to be created. Areas, suppose that you have to see which areas to be vacated and where victims will be kept. And you have to see for the standard operating protocols, which has to be in place beforehand, before any disaster occur. So always make a SOP of the things, always make a Almira. Usually in every hospital, we have crash cards in an emergency, but crash cards are not always suffice. That doesn't suffice for the disaster management or in the times of disaster management. So Almira has to be kept where we know, supposedly if the patient comes with a disaster, we should have this much of gloves, this much of any cannulas and IV fluids, and it should be there all the time, refilled at proper intervals and checked for the expiry dates and everything. And there should be SOPs made exactly how to work when a disaster happens. Because once a disaster happens, it doesn't give us time to prepare for those things. We have to do the things, mock drills prior hand only, in order to see how much effective functioning we are. So in this, nurses should understand that the facility available resources are limited. So they have to work in unison, obviously, to cater those patients. And emergency communication plan has to be there. And public education and awareness has to be there. So always try to take the main stream people of your locality into account. Suppose if something is going to happen, we need the blood products and all. So they will cater because they are the leaders of the community. They will come along for all voluntary donations and also they have to be, until unless you will educate them with the things like what is the requirement during the phases of disaster, they won't be. So at the time of disaster, before that, go for the public awareness and education programs, which is one of the our nursing people are doing in our hospital also. They go to the nearby schools, nearby communities, and make them aware of many things, not just disaster, many things also, the hygiene and many more things, and obviously the blood donation and many more things. Okay. So in every hospital, disaster management committee has to be made. In this, the chairman is usually the director or the medical superintendent of the hospital. The management committee consists of nursing superintendent, casualty medical officer, and all the heads of anesthesia, medicine, surgery, blood bank, radiology. Obviously, the security personnel also plays a major role in this disaster management committee because, as we know, there is a mob there, which are there. Everybody is saying, just scatter me first, just scatter me first. So there has to be some security personnel who are on duty in order to make us, the nurses and the doctors, work in unison and in a smooth fashion. And the transport officer, this is very important. There are few things which we always tend to forget. Suppose our facility doesn't have anything which is lacking in our facility, we need to shift these patients to some higher center. So the transport officer needs to be intimated prior hand, like be ready with the ambulances. Maybe we'll be shifting few patients to the higher center also. And the sanitary personnel, obviously you can well imagine in a case of a disaster, there are so many patients, attendants over there, and how the littering can be there. So all these, we all have to work in unison in a disaster management committee in order to cater a disaster. Then comes the impact and the response phase. In this, actually, we have to go to the site, get the patients to the facility, and then provide them with the relief and the support. So the rescue operations is there. Triage we have to do in our emergency. As I told you, there has to be delineated nurse already who will see the patient first and he will give the triage, which patient is red, which is yellow, black, and all. I will be talking. And then obviously we have to see which patients to be referred if we cannot cater those in our facility. Then comes the mitigation phase. In this, the measures are designed to prevent the hazards from causing the emergency or to lessen the likely effects of disaster. Obviously, as I told you, education programs by the nurses plays a major role, and the disaster prevention measures, how to cater everything and how to prevent those disasters. In this, the nurses play a major role by public education, community awareness program, and community participation. Now actually comes the triage now, in which it is derived from the French word, which means to sort out or to choose. Like in this, with the limited resources, as I told you, we are catering in the emergency of 20 people, 20 patients, we are catering maybe 200 people. Okay. So obviously the triaging needs to be done. Triaging simply means which patient needs the treatment at the priority level. If some patient, suppose a dead patient is there, you are wasting your resources on a dead patient, doesn't make any sense at the time where we have limited resources. So in this triaging, we have to sort out which patient to be catered first. So there is basically it is a process of prioritizing which patients are to be treated first, and is the cornerstone of good disaster management in terms of judicious use of resources. So what are basically the aims of triage? It is basically inadequate resources to meet the immediate needs. to provide the prioritized care to the injured, to assist the patient. We know the sisters are sisters, they know the infrastructure limitation. Obviously, they can cater in the best possible way. They know the hospital resources also. They know which things are kept where, how to deal, how to go about it. So all these things will be done by the nursing, and this is our aim of TRIAGE. In the principles of TRIAGE, every patient should receive and triaged by the appropriate skilled healthcare professional. It is a clinical managerial decision and must involve the collaborative planning. It should not cause a delay in the delivery of effective clinical care. All we know, we have 4 TRIAGE categories. In the red, we have the immediate or the emergency. Like in this, the patient cannot wait. You have to immediately cater that patient. And we have different bands. You must have all seen those bands, red, yellow, green, and black. Whenever you see any the sister who is in the emergency, who has been allotted with the work of TRIAGE, she will see whether this patient needs an immediate like resuscitation. So she will put a red band. And then there comes the yellow ones which need urgent. Urgent means they can wait for a little while before we cater the, first of all, we have to cater the red patients, fine. And then they can wait for a little while, then we can cater those people, they are turned into the yellow. Then comes the green, non-urgent or the walking wounded people. There are small abrasions, there are some small kind of things, they are come into the green. They are walking, but they are wounded, okay. And last of all, there comes the black category, in which the patients are usually dead and they have little or no hope of survival. I was talking of these patients only. Suppose you are wasting your resources on such patients, there is no point wasting the resources on such patients when already we are in short of resources, okay. So in the class for red, we have the immediate. In this, the victims with serious injuries that are life-threatening but have a high probability of survival if they received immediate care. They cannot wait, and they are likely to survive with immediate treatment. So that is the thing, we have to intervene at this point of time, and surgical teams need to be intimated. Suppose there is a shock patient, trauma patient, hemorrhagic shock is there. So obviously the airway needs to be secured. He has to be taken to the OT because of splenic injury or hepatic injury. Is a young patient. We all know he can make it if we give him timely management. So such patients, they come in the category of the red bands. And why the bands are important? This is a very important thing, because supposedly a doctor comes to the facility, he has just entered the facility, he doesn't know which patient to be catered first. And in such a chaotic situation, every person is working overwhelmingly. So what will happen? The red band obviously will show this patient needs immediate care. Even if somebody doesn't tell the doctor or any other fellow colleague, the person will come to know that this patient or this victim needs an immediate care. And obviously the resources are limited. Okay. And next comes the yellow delayed ones. In this, the victims are seriously injured, but whose life is not immediately threatened, and they can delay the transport or the treatment for 2 hours. They have to be watched for. It's not like that we can see transition from one to another. Like suppose the patient was in the yellow, this band, he was having the yellow band, and now the bleeding suddenly has increased and his BP has fallen. He has gone into the hypotension. Now this fellow will go into the red band. Obviously, it's a dynamic change. So the yellow people, they need to be seen, monitored in the hospital facility also. Yes, if they stay stable, then they have to be catered after the red patients they have been catered. In this, we can see an open fracture, a chest wound kind of injury. And then comes the class 3 is the non-urgent or the green band patients. In this, they are walking wounded, and the CMO casualty medical officer, when all higher priority patients have been catered, evacuated, then these patients need to be catered. And they have to be transported, but they can wait and watch, and you can counsel them because they are usually awake, alert, and they make such a hue and cry. So you need to tell them, see, we have other prioritized patients in which we have to give the resources. You can wait for a while, you are being monitored here. And such patients, they are level into class 3. So they are with the minor injuries and the closed fractures, there may be sprain, abrasions or something like that. Then comes the 4th category, which comes the black. Expectant, though this is not a very good category, but there are severely injured people. Suppose the patient is brain dead, he's having a lethal radiation dose or a severe trauma is there. Patient already having the cardiac arrest, severe head or chest wounds are there, and we are not able, even if we try the best of our resources, we are not able to make this patient come back to the life. So such patients, they are in the black category. They should be given a pain relief with the painkillers, and they should be made not to suffer exactly. Okay. So such patients are dead who are expected to die because of massive head injury or extensive full thickness burns are there or whatever the reasons are, but they should be made pain-free. So next comes the recovery, reconstruction and the rehabilitation phase. In this, our role of nurses is very important. They make the community come back to its disaster status. We all know that our sisters are very empathetic. They need to listen to the attendants, to the victims, their woes, their everyday stories. Obviously, everybody is in mental trauma. So they need to give emotional care to the patients and the attendants, and counseling and the behavioral modification has to be done from their side. And they have to provide care and shelter to the survivors. There was a study on disaster preparedness among the nurses. It was a multi-national study in which there was from Oman, Australia, and USA. The many hospitals, they took part in this study. But the study results were not that, I would say, good enough. The reason, like the conclusion they were find, even the best of the centers, the nursing people, they are not that well versed with the disaster management, disaster response, I would say, because the SOPs, they were not in place, because the nursing educators, they need to educate their nurses how to cater with the how to prepare, how to make them aware, how to make community aware. So you can see, not in India, even the best of the abroad hospitals also, the study has been done which shows that there was lack of disaster preparedness by the nursing team. So I hereby take this forum to request all the nursing educators, first of all, to educate their nurses and to make them apprise what the disaster actually is, make SOPs, make Almira for the disaster management, and obviously make some go for the mock exercises, mock drills, the alarm systems, code orange to be to be done as mock drills, and how areas to be delineated. Suppose in my hospital we have delineated an area in case there is fire or there is some collapse in the building, which area is we have to cater, we have to be in the area, which area, ground area, open area, which we have to be. So in that way, in that sense, I will request all the nursing educators here to make some protocols. Then only this lecture will be of little help to you people. And triaging is very important. Make your sisters apprise of the triaging, because at any point of time when the disaster will happen, you will not make them learn. It is prior only the preparedness which will help us to cater those disaster victims. Okay. So we at the Narayana hospital, obviously I will consider the COVID also as a disaster. We all know we lost so many lives in the COVID times, but our nursing, like it was commendable from my hospital. In the COVID-1 wave, total patients we admitted was 783, and there was 72 deaths only there. And our staff among 900, 200 got positive. Almost 22% staff was got positive in the first wave, but still they worked day and night, and we were able to salvage a good amount of patients. Almost you can say 90% of the patients were discharged home in all the 3 waves. So hereby the Narayana, my hospital, obviously nursing is very strong in my hospital with all the mock drills in place, with all the SOPs in place. And this was the Vaishno Devi disaster. It is just nearby my hospital, around 20 kilometers, since my hospital is placed in Katra. So just to make you apprise, there were 20 patients we received from the Vaishno Devi stampede, and almost 5 were intubated. And next morning we extubated all the patients. You could imagine, I could recall a story here. The next day when I extubated one of the patient, he was having the fracture of the lower limb. He was recalling all his things. He said कि मैम मैं गिरा था, मेरे ऊपर 4 लोग और गिरे थे और मेरी टांग बीच में स्टक कर गई थी. मुझे लगा या तो मैं बच सकता हूं तो या तो मेरी टांग बच सकती है. So I preferred my life obviously over the leg. So he pulled his leg underneath the 3 to 4 victims who had fallen on him. So well, you can imagine the trauma he might have undergone during those disaster. And our nurses, our nursing staff, and our doctors, they played a very major role, and we could salvage all the patients, all the victims who were alive, who came to our facility. Rest, there were few casualties also in this stampede, which we couldn't help out. But because of the disaster preparedness only, we could cater so much of patients. So the take-home message is from this lecture is, it is nursing workforce is an integral part of disaster management team. They should work with confidence, command, coordination, and control with the effective use of communication skill in the affected community. And I salute all the nurses working day and night all over India and abroad, who are just a backbone of our hospitals and all the societies. And last but not the least, we cannot stop natural disasters, but we can arm ourselves with knowledge so many lives would not have to be lost if there was enough disaster preparedness. Thank you.
Thank you, Dr. Vanilla, for such a insightful talk. I would ask the participants if they have any questions for Dr. Vanilla, any clarifications that they require or anything they want to ask Dr. Vanilla. We are open to answering the questions. Right now, I cannot see any. So, in your experience, I suppose that this continuous education program for nurses, in your experience, how frequent it should be, and do you reckon that this is very important for the nurses to learn new things and learn about all the intricacies of how to go about managing patients?
Yeah, in our facility, like we have made a SOP and a protocol that every month we go for a orange code. Orange code is a disaster code. We go for a red code. Red means a fire code. And anytime the code blues, obviously the mock drills, we have make a calendar of it. So every month we just go for a mock drill without anybody's knowledge. Only the few people who are running the code, they know we have, and we see the lacunae where we are lacking. And obviously we work on those areas. And then obviously our hospital has catered many disasters, not this one, but many. So, but we have found very good results, all because of the SOPs in place and nursing being educated and made aware time and again what has to be done, which has to be allotted to them, all the things. So that has really helped us. So I request everyone to go for it.
Thank you, Dr. Vanilla. So any questions that the participants have, we are open to answering. Any queries that anybody has about triage and a little bit about disaster management? I still cannot see any questions, Dr. Vanilla. So
we take a leave then. I think I have made little bit issues clear.
yeah, it was a pretty nice talk, and I must say that you've talked about disaster management in a very stepwise pattern, and just to impart a piece of knowledge that yes, preparedness is very important, and along with that, every hospital needs to find their own means and methods to train the sisters in an adequate way, so as whenever such kind of scenarios happen, like the hospitals are well prepared. So I think we can terminate the talk here, I suppose. Thanks a lot, and thank you all the participants for your valuable time. We hope to get together again with some other pearls of wisdom. Thank you so much.
Thank you. Thank you, Dr. Anjali, and thank you all the participants for the patient listening.
Thank you.